Medicare doesn't make any sense. So it's really important to understand maybe a little bit of the history of Medigap supplement plans and alphabet letters. Medigap supplement insurance plans have been standardized by the federal government since July 1st of 1993 so that all plans offer the exact same coverage and benefits based on that alphabet letter. Medigap supplement plans are each assigned an alphabet letter like how original Medicare assigns Part A for hospital and Part B for medical. So it makes it really easy to understand that they're a direct extension of Medicare. An individual can still get confused though because original Medicare will refer to the alphabet letter as a part and the Medigap supplement plan will refer to the alphabet letter as a plan. So remember, Medicare is a part, Medigap is a plan. If an individual is looking at the Medigap supplement chart, they'll see that the basic plan offered is Medigap Plan A, which is not the same as Medicare Part A. These differences are confusing to someone that does not completely understand Medicare and make it seem like this all does not make any sense. Again, Medicare sometimes doesn't make any sense. So there have been some Medigap plans that have been eliminated in the past. So starting on June 1st, 2010, the federal government decided to stop the sale of Plan E, H, I, and J, including the high deductible Plan J, and added two new alphabet letters, Plan M and Plan N. Anyone that had Plan E, H, I, and J, including the high deductible Plan J, prior to that date could keep it and were grandfathered indefinitely, but no one new could actually purchase it. The reason these plans were eliminated was because some of the additional benefits that were offered under these plans would actually now be offered and provided by original Medicare, which we're going to discuss right now. Let's talk about Medigap plans E and J. What they did was they provided additional benefit of up to $120 a year that the policyholder could use towards preventative care. See, original Medicare did not cover preventative care at 100% before that time period. Starting on January 1st, 2011, original Medicare was now required to cover preventative services at 100%. So what this did is it made that $120 a year benefit on Plan E and Plan J obsolete. It was no longer needed. Another benefit that was removed from Medigap plans D, G, I, and J was a benefit of up to $1,600 a year towards personal home health care recovery. So let's talk about this right now. It's important to understand what the home health care recovery benefit was used for and why it was actually removed. The $1,600 benefit could be used for personal home health care services like that of dressing, laundry, cooking, etc. Original Medicare, remember, does not cover personal care. They will only cover skilled care. So this was a big benefit that was offered under this plan. The individual could get a maximum of $40 per visit for personal care with up to 40 visits a year when that skilled home health care service was actually no longer needed. What ended up happening is CMS decided that they would remove the $1,600 personal home health care recovery on the Medigap plans after June 1st, 2010 because they found out that it was actually seldomly used by any individual. There was one last benefit that was removed from the Medigap plans. The last benefit that was removed from Medigap plans was prescription drug coverage. Remember, prescription coverage is not covered under original Medicare Part A and B. So for those needing prescription coverage, they could get it as a benefit, including the Medigap supplement plan H, I, and J. See, when CMS implemented the Medicare Part D on January 1st, 2006, it made the Medigap supplement plans H, I, and J no longer necessary to cover this additional benefit of prescription drug benefits. The most popular plan prior to June 1st, 2010 was the Medigap Supplement Plan J because it offered the most comprehensive benefits of the preventative care, the personal home health care recovery, and the prescription drug coverage. Once CMS made the Plan J no longer available to anyone to purchase after June 1st, 2010, everyone began to focus their attention on the Plan F. The Plan F offered the most comprehensive coverage and was the most similar to the benefits of the discontinued Plan J. The Plan F enjoyed the next decade as the most comprehensive plan that Medigap offered under CMS until they decided to make some more changes again to the coverage options available to new beneficiaries to Medicare. So beginning on January 1st, 2020, CMS decided that they would do something a little different than they'd done in the past to Medigap plans, which created a lot of confusion during that time period. This time, instead of eliminating alphabet letters, the federal government stopped the sale of Plan C and Plan F, including the high deductible Plan F, to anyone new to Medicare. So any individual that was eligible for Part A prior to January 1st of 2020 will still be able to continue to purchase this Plan F for as long as they want. Those that are eligible for Medicare Part A prior to January 1st can keep that Plan F or Plan C and will always be grandfathered into purchasing these plans. CMS did not eliminate these two plans. They just made them no longer available for purchase to anyone new to Medicare after 2020. So if you are new to Medicare now after 2020, the most comprehensive plan now available for purchase is going to be the Medigap Supplement Plan G and the Medigap Supplement Plan N. CMS wanted to eliminate first dollar coverage. That's one of the reasons that they no longer made available the Plan F and the Plan C. So CMS made these changes to Plan F and Plan C effective on January 1st because they didn't want to offer first dollar coverage. So what does that mean? That means that the Plan F and Plan C would pay that small Part B deductible of $203 in 2021, leaving the policyholder without any out-of-pocket expenses, but just a monthly premium. Congress felt that by requiring all newly eligible Medicare beneficiaries after 2020 to be responsible for the small Part B deductible, it would help reduce medical overuse. Typically, anyone that's on Medicare will only have 3 plans that they're going to look to purchase, which are the Plan F, the Plan G, or the Plan N. Even those individuals that are grandfathered into purchasing the Plan F still are looking at the Plan G or the Plan N for cost-saving reasons. Anyone newly eligible to Medicare will only be looking to supplement Medicare A and B with the Plan G or the Plan N. If you are newly eligible to Medicare, the only 2 options you will have is Plan G and Plan N. If you've got any questions at all, please call us here at Healthcare Solutions Direct so that we can look at the different options to make sure that you're doing what's best for your actual needs.